All right, so it's 1:02. We will go ahead and get started with our presentation. We appreciate you all joining us today. We know that everyone's busy, so we're going to try to keep this timely for you. Obviously, workforce continues to be a major concern in our community, and health insurance is one of the benefits that are often cited as a key factor in employee recruitment and retention. So we know that this is a very important piece to your recruitment and retention efforts with your workforce. So we're really excited to be able to offer this benefit to our chamber members for you to be able to take advantage of. And we're really excited. We have Cindy here from NOAC, who's a part of the presentation. We're a proud member of NOAC. And then today we have Nancy Kuzenko, who is with Anthem, and she is an account executive with Anthem Blue Cross and Blue Shield, and she's going to give us a presentation and teach you a little bit more about the program and how you can get involved.
Great, thanks, Samira. So hopefully everybody can see my screen and you can hear me. I guess there is a chat, so I don't know if I'll be able to respond to things in the chat, but Samira can follow back up with me on if there's any takeaways. So I do handle everything that's small group. So that's at least 2 employees to no more than 50, full and part-time. So the first thing I wanted to talk about, you may or may not know, we've changed our corporate name. So this is at the Wall Street level, from WellPoint to Elevance Health. Again, we're involved in a lot more things than just being a Blue Cross Blue Shield partner. We've got Medicare products. We do a lot with the labor trust market. We're involved in the Medicaid market. And of course, a lot of the pieces and parts that we touch, it could be mental health providers, our pharmacy services. They just thought that changing the overall name allowed again, our customers across the entire spectrum, not just those that carry a Blue Cross and Blue Shield ID card, to really understand kind of where our enterprise strategy is going. So everybody, we're still going to market under Anthem Blue Cross and Blue Shield for anything to do with health insurance. But I think some people were asking, like, what does Elevance Health mean? So if you're looking for us on the stock market, we're going to be under Elevance now. So Anthem and NOAC has had a long time partnership back to the early 90s. So it's been many, many years. We offer a number of different discounts through a variety of group size markets. Of course, small group 2 to 50. We have a discount on our grandmothered or transitional products. We offer a discount on our guarantee issue ACA small group products. Of course, there are discounts built into our medically underwritten SACA benefit plan products, which is our MEWA product. And we do offer discounts to our large groups. So it could be key accounts, which is our 51 to 99 segment, or our 100+ true large group accounts. We've got whole health savings credits. I mean, we know, as Samira said, employers are looking for employees, to show up to work, that want to work, that are going to show up on day 2. And it's no longer a matter of what is the salary. It's really what the package is. So a lot of employees are not only looking for medical benefits, they're also looking for dental, vision, life. So we've made some pretty cool plans available, especially for smaller employers. Certainly they're available for large groups that actually have discounts tied to them. So employers are able to do that. So the SACA benefit plan, it is our medically underwritten product. We've got about 92,000 members currently enrolled in that product. We launched it. It was the first MEWA, which is multiple employer welfare arrangement, in the state of Ohio, certainly followed by some others, but we launched SACA benefit plan at May 1 of 2016. We do offer 12 PPO plans, 3 plans that have a 3-tier cost structure. So there's a level 1 and a level 2 in-network benefit. Level 1 benefits have a lower deductible, better coinsurance. Level 2, higher deductible, a little less for coinsurance before you get to out of pocket. The 3-tiered plans I like as an option. There's about a 9% difference between the 3-tiered products and a standard 2-tiered product. So for an employer that's really trying to hit certain price points, I like it as an option for employees to be able to select. And then, of course, we still get a lot of call for our HSA plans, which are qualified high deductible compliant plans that can be packaged with the freestanding banking, where monies can be payroll deducted on a pre-tax basis. So people are paying for known and unknown medical expenses with pre-tax dollars. What is considered small group, especially for determining market segment size, is at least 2 employees to no more than 50 total, full and part-time. So there could be a group, we see it a lot with like pizza shops. So there could be 5 full-time employees, but 60 part-time. You know, that you've got a lot of high school kids or college kids that are working a couple hours on and off. That actually would be quoted in our large group segment. So it's not necessarily based on how many are enrolled, it's total belly buttons. We do write a lot of husband-wife groups in Sakamiwa, and we are able to do that as long as they both work 30 or more hours per week and they both receive a wage. They would both be considered eligible to enroll. Because we need to have at least 2 enrolling, we split those contracts. So typically the husband would enroll as a single, the wife would enroll as a single, or the wife would enroll covering the children. We also can write sole proprietors, including dental and vision coverage. The key to a sole proprietor is they cannot be an LLC or a corporation in any fashion. If they are, they're not considered a sole prop. Sole props receive wages on IRS 1040 Schedule C. The other thing that we make available to small employers, again, is flexibility. A lot of times the employer themselves, higher dollar earner, wants to take advantage of the savings that are available through an HSA plan. Lower waged employees, maybe not so much. They want the comfort of an office visit copay, first dollar drug card. So we allow employers with 3 to 9 enrolling to select up to 2 plans. Employers with 10 or more enrolling can select up to 3 plans. So whichever 2 or 3 plans they would like. We also give employers the flexibility of including coverage for domestic partners. So they can be included or excluded. That's really a choice that is at the employer level. And then we do offer integrated banking for the compliant HSA plans through Wealth Care Saver, which can be done electronically. So once someone is enrolled in Anthem system, that enrollment would automatically be sent to send the HSA card out through Wealth Care Saver. So we would coordinate that enrollment on the banking with them. So our Sydney Health app has won a lot of awards. It's really our artificial intelligence, very, very intuitive, helps an employee really get engaged in their benefits and helps them stay connected. So you don't need to be in front of a laptop or a desktop. The Sydney app can be downloaded through the Apple Store or the Google Play Store onto your smartphone. It really allows employees to take their health plan, their benefits, their electronic ID card, which is just literally a picture of the live ID card anywhere they go. So if the dog ate somebody's ID card, the member can log into Sydney, request a new hard copy, but always has the comfort to know that they've got that ID card with them all the time. It also allows them access to claims, their benefits. They certainly can search for providers to find out who's in their network. They can join wellness programs through the Sydney app. We know a lot of people track their steps. So there's tools in there that allow employees to do that. There are wellness challenges that get put out in Sydney. Grandmothered groups, again, don't have 100% of the Sydney Health app access like our Sakamiwa or our ACA groups do, but Sydney is great. So part of Sydney that we launched in 2022 is something that's called Engagement Package 200. And we actually stole this from our friends on the large group side because they've had this program available for the last couple of years. It used to be known as Get Strong. It's now Engagement 200, even for large group. But what we found is the more employees know about their plan and their benefits, the better users they are. Again, with COVID, you couldn't go into a doctor's office to get your preventative care. All of those services are covered at 100%. Now that things are opening again, we want to make sure that people remember they've got those benefits. And we're going to incent them through gift card rewards, again, for using benefits that are available to them. And this comes at no additional cost to the employer. So we do include the summary of benefits is something typically that the brokers use in employee meetings, or we would use if we're involved in the employee meetings. It's a very detailed summary of benefits. It's approximately 13 to 15 pages, depending on the plan. There's a very specific section that talks about the Engagement 200 package that's available. So what Engagement Package 200 looks like, again, it's available to enrolled employees, spouses, or domestic partners if the employer has opted domestic partners in. Each one can earn a maximum of $200 by either participating in wellness things or condition management programs or preventative care, anything that's referred to as claims. Once that claim comes into Anthem system and is processed, those dollars automatically populate to the members' Sydney app. So if they have their vision program with us and they get their annual eye exam, they're going to earn a $25 reward. If they get their routine adult wellness exam, they're going to get another $25 reward posted to Sydney. Certainly their cholesterol test would be part of that routine physical, their flu shot, mammography certainly would be limited to females. So each person is going to earn that $200 potentially in a different way. And then on the wellness side, again, if they do something as simple as connect a different device, they're going to earn a $5 reward. If they log into the website or the app, there's another $5 reward. Certainly if they track their steps, there's somebody, again, that's more health conscious that wants to keep track of that. That's a $60 reward. And then on condition management, these are going to be things that certainly are for people that have very specific conditions. So it could be future moms, somebody that is currently pregnant. Pregnancy number 2 could be very different than pregnancy number 1. So future moms gives that female access to a specific registered nurse that specializes in all that prenatal care. Again, there's tobacco cessation programs, there's weight management programs, and then condition care participation is for very specific things like asthmatics or for diabetics or someone that's got cardiac issues. So there's a whole combination of different ways that each employee, spouse, or domestic partner can earn that $200. And then what it looks like in the Sydney app, again, is very simple. So they log into Sydney, they go to My Health Dashboard, and they can see what they've earned on their rewards at any given point in time. So in this example, this person has earned $120. So far, as soon as there is $25 in the account, they're able to start redeeming. There's 8 different gift cards they can select from. Things like Home Depot, it could be Amazon, it could be Best Buy, it could be TJ Maxx. Again, 8 different gift cards they can select from. Visa, MasterCard is another one. So they can kind of keep those dollars accumulating, or they can, as soon as they have $25, they can cash it in and spend it at Amazon. So it's very, very easy to see what dollars you've accumulated, what other incentives like your wellness exam. So maybe you haven't had your preventative care visit. It will let you know that's still dollars that are yet to be earned. Of course, females would have the mammography reminder. And then depending on your age, the colorectal screening. So again, it's super, super easy. It's all done online. We don't mail out gift cards, unfortunately. It still can take an inordinate amount of time. I know I mailed a check down to our Columbus sales office. It took 2 weeks to get there. In fact, I wondered if it got eaten by a machine, but it did finally end up showing up. So they're actually a virtual gift card. So as soon as the member redeems it, they'll see those dollars removed out of their rewards tally. And they would actually, again, in this example, the person's opted for $25 in an Amazon gift card. So you can use these, again, for gifts. You can cash in $200 all at one time, or maybe you're going to cap out and only get $160. You can get $160 in one gift card, or you can split it into multiples. So it's very, very easy. Virtual primary care is also something we're seeing a lot of attraction to. So it is available 24 hours a day, 7 days a week through Sydney Health. They're able to text or have a video visit with, excuse me, a provider. Again, it automatically lets the provider know. K-Health is who we actually use for our virtual visits. They can integrate lab requests, pharmacy, certainly for non-controlled substances. It also allows us to route things certainly within Anthem if there's an opportunity for reach out. So again, it really allows that particular member. So Sydney will customize everything about my portal for Sydney versus someone else's portal. So if I may, check on my deductible all the time, the first thing Sydney will remember and will give me a quick link to go right to my deductible, or maybe right to my health incentives. So very, very cool. Smart Shopper is something that is also very unique to Anthem. So Smart Shopper is available to over 400 different shoppable procedures. So they can call one of the Smart Shopper advocates, which is what I suggest somebody does the first time, so they kind of understand how it all works. Members can certainly do it online, but what it identifies, it certainly would not be used in any type of emergency situation. Once a procedure is recommended, maybe it's a colonoscopy. If you call the Smart Shopper, again, the key is that you have to use Smart Shopper before the service is rendered. The Smart Shopper advocate will help identify high quality, lower cost options. So a freestanding endoscopy center would have a lower overall price attached to it than, say, outpatient hospital for the same procedure. So the member can still select to use outpatient hospital if that's what they like, or if that's what they want to do. If they end up opting to use one of the high quality, lower cost options identified through the Smart Shopper advocate, once the claim is processed, the member actually participates in the savings. So they actually get a check in the mail approximately within 6 weeks of that claim being processed. So it really allows them to fully be aware of what their options are, who the providers are that can render those services. It comes at no additional cost, so it's no additional cost to the employer. It can actually save the member money out of pocket, certainly toward the total expense. And they're going to get educated and end up potentially with additional money back in their pocket. So that's very, very cool. We actually launched this in small group back in 2017, and we've since made it available to our large group customers as well. Excuse me. So the whole health savings products, again, this is an incentive that we make available. This is specific to SACA benefit plan, and it is to help certainly small employers, because that's who's eligible for SACA benefit plan, the ability to offer dental, vision, and at least 25,000 in life. And then we actually give the employer a credit back on their medical invoice. So if we kind of look at what the premium costs to add life insurance. So if a 2Life group adds life, there's $100 credit that's the group is given back on their medical invoice. So that $100 credit typically picks up 8 months worth of the life premium. So the group's actually paying for 4 months, but giving the employees 12 months. Same type of thing works for the dental and the vision products. So again, we know employees want those benefits. We know not every employer has the money to pay for those benefits. So again, this is a way that we found, and most groups that we write take advantage of this. If they don't, it can be added at renewal, or it can be added off cycle as well. Again, the only life has to be at least $25,000 in a benefit. So we can sell our specialty products standalone. We've all been doing this a long time, so we know I may not, or Anthem may not always be the fit 100% of the time for the medical plans. So we do offer our specialty suite of products on a standalone basis. So we can't attach the whole health savings credits, but we do offer discounts through the chamber on our standalone dental, vision, and life products. So we call it ACA, even if it's standalone specialty and not medical, because that's the platform that we set it up on. So again, there's additional bundling discounts. If we have a group that we've got the medical on and the medical enrollment matches the dental, there's something that's called a medical lock discount. We've got chamber discounts available. There's discounts if there's multiple lines of coverage purchased. So again, we try to do everything we can to help small employers be able to offer these levels of coverage, because we know that's what employees are telling you that they want. So why Anthem Dental? We've got the largest dental PPO network across the country. We do have a new unlimited plan that we're seeing a lot of activity on. So typically a dental plan, standard dental plan, has a $1,000 max out of pocket on it per calendar year. Anybody that's had the pleasure of having to get a root canal and or crown knows that depending on where you go for that, you could be spending $750 of your max toward that fabulous root canal. The unlimited benefit, again, offers no annual maximum of the benefits that can be had. The price is not a lot higher. It's maybe $6 or $7 higher on the single. So we're seeing a lot of activity on that. We've got accidental injury. So this is injuries to sound natural teeth, not, you need a cavity filled or you need to have your teeth cleaned. And we do cover posterior composites. So those are the white fillings that can be done in the back of your mouth if you don't want the amalgam fillings, which are the ones that look silver. And all of our plans include coverage for implants, and we're seeing a lot more activity, excuse me, on the implant side. The other part that we think is super important, and we've learned this from some of our large national accounts, who really dig into their claims and, have somebody go in and do an analysis. But 90% of things that happen in your mouth are signs of things like high blood pressure. It could be early signs of diabetes. It can even be something as severe as early signs for heart-related issues. So again, a dentist can tell just through a simple exam and cleaning if there's stuff maybe going on in the rest of your body, which is another reason why we think it's important. Employees want it. Again, early detection, we all know the earlier something is detected, the sooner it can be acted upon, the lower the overall costs are going to be. Kind of same thing on the vision piece. I mean, think about it. You've got employees in your workroom. It may be an office. It may be a machine shop. It could be a plant. People need to be able to see when they're driving a car, when they're operating your equipment. We've got one of the largest vision networks in the US. We've got a lot of the big box stores, as well as a lot of the local optometrists and ophthalmologists. Transition lenses are automatically included for children at no extra cost, and we include them for adults at $75. Again, we know that things like macular degeneration, excess sunlight to the eyes can cause things that don't happen or don't show up until you're 70 and 80 years old. Again, when you're 70 and 80 years old, you still need to be able to see. And 75% of adults use or need some type of vision correction. So I certainly, when I'm on the road, I want to make sure that people can see me and my car. So again, vision, again, you've probably heard people reference, a doctor giving you an eye exam. Again, it's again another window into the body. So when you're getting that routine eye exam, they're looking at the health of the veins behind your eye. Again, very easy to detect things like diabetes, high blood pressure, other kind of things that are going on within the body that need to be addressed. And then, of course, life and disability. A lot of employers offered this benefit previously. A lot did not. Most employees, the only life benefit they have is the benefit that's through their employer. If you buy a personal life policy, again, you're having a nurse come to your home, you're having to do blood tests and urine samples, you can get denied. On the group side, that's all guarantee issue. It's going to be the least expensive cost. And a lot of people, again, don't have life insurance. The most common plan out there is $15,000, and you need at least $25,000 just to cover final expenses and any unforeseen circumstances. So again, that's another reason why we make the whole health savings credits available for life, and we kind of set that minimum policy at $25,000. So our groups of 2 to 50, even the smallest group is guarantee issue for at least $50,000 in life. Of course, the bigger the group, the more we can go up in that guarantee issue amount. But the other thing that comes with our life products is something that's called a resource advisor. So they've got counseling and consultation. So it's kind of like a mini EAP. It's kind of built into that life product. They've got online services, tools and resources. Again, they've got college locators, things that people need help with. There's travel assistance if somebody's traveling more than 100 miles from home. Again, resource advisor will help make arrangements to get them home. If it's getting them towed, to the local dealership and getting them a rental car, they help with those arrangements. And then beneficiary companion, certainly after someone passes away, there's actually hands-on service to help maybe a surviving spouse or other family member, help explain to younger children what's occurred, There's a nice book that's mailed out that kind of walks that person through the process on how to explain that for younger children. And then, of course, disability. 74% of employees would not be able to pay their bills if their paycheck was delayed 1 week or more. So that's kind of a disheartening thought, I guess. Again, most people, if they get disability coverage, it's through their employer. They're not out purchasing an individual disability plan unless they are like a dentist or a doctor, and then they need to. And 90% of disabilities, believe it or not, are caused by illnesses. Could be COVID or pneumonia or something like that, not accidents. So I think that's pretty telling. And of course, we have a very personalized claim support program to help our providers document the disability, certainly help our employers work to get those people back to work and get back to health in their regular lives. And our disability rates are very, very good. So what sets Anthem apart from other specialty carriers? On our dental and vision plans, we do not require a minimum contribution by the employer. So we can use the employer rates even in a voluntary setting where the employer is not contributing to premium, as long as we meet minimum participation requirements. So we need to enroll at least 50% of the employees for dental and vision, down to at least 2 enrolling. And of course, if they've got vision or dental benefits through a spouse, that would be a valid waiver. So it's very easy to meet participation. Plus, the employees get 1 ID card for all benefits. So if they've got medical, dental, vision, they get 1 ID card that's got everything on it, which makes it very easy on the provider side. And employers get 1 group number, not multiple group numbers and multiple bills that they are trying to juggle and pay. So Perks at Work is something else that's available that comes with our life products. So it gives employees discounts on things that they use every day. So it could be flights and vacation services. It could be discounts on computers or tablets, discounts at places like Six Flags or Kings Island. There's discounts on vitamins and supplements. There's an employee car buying services. Discounts on cell phones and things like that, gym memberships. So they're all things, these offerings expand, so they're not always stagnant. So there's always things that are being added to that Perks at Work piece. And of course, these come at no additional cost. So as long as our life product is purchased, that resource advisor program is automatically built in. So employees are getting that at no additional cost, which includes the travel assistance. Living benefit is also available. So if an employee is diagnosed with a terminal illness and kind of they are given a limited amount of time remaining, they can actually use up to 50% of their life insurance benefits before they pass. So if there's bills they want to pay, maybe somebody wants to take that lifetime trip to Hawaii they've always, dreamed about, they're actually able to use some of that money. And then of course, the beneficiary companion, it's got that healing book that kind of helps people work with children that are involved in a family death. And then on the employer side, again, we've got very, very robust tools. So our Employer Resource Center gives employers things to make their administration very, very easy. So there's videos, there's blogs, there's wellness tools that are out there. Every employer kind of interacts with the Resource Center a little differently. Again, you've got contacts, phone numbers, links to commonly used forms. It's a very interactive, resourceful piece. And then our actual employer access portal. So this is actually what we make available to groups as soon as they're live. So the employer and or the broker is able to go in to employer access and add employees, change employees. Maybe we need to remove a dependent because they have a job through their employer now. You can go in and add, change, or terminate. The benefit of doing it right on the employer access portal is it is done in real time. So as soon as you add, John Doe and his spouse and dependents are immediately in the system. Even if John's effective date isn't until 8/1, let's say, or 9/1, depending on the waiting period, John's in the system. John will appear on the bill timely. John's ID card generates the day that you add him. Same thing on employee terminations. Like as soon as you go in and terminate John Doe, he is removed from the system and would no longer appear on any forthcoming invoices. Our MIWA groups invoices generate on the 10th, so they are ready to view in the employer portal on the 11th. We always mail a hard copy out. Again, we're counting on the US Postal Service to deliver those timely. So hopefully by the 20th of the month you have it. Again, we know small employers are looking at cash flow. So as soon as that invoice generates, you can see exactly what the invoice total is on it. Locating benefits summaries. So those are those summary of benefits, or SOBs. So those are the very, very detailed 13 to 15 pages that we would use in an employee meeting, or we suggest that you use for new hires. The summary of benefits and coverage, or the SBCs, that's kind of the 5-page document that your government wants you to provide to employees that give them a very brief snapshot of how their plan works. So they're used in conjunction with each other. When you're logged in and enrolled in our employer portal, you've actually got links right in employer access for the SBC and SOBs for whatever plans that we currently have active. If for some reason the employer portal's down, let's say it's a Saturday night and we're doing maintenance and you need to download the SOB, you can go to one of the hyperactive links to do that. And again, it's very, very easy to get set up. Once you're live in the system, you need the group number. You go to anthem.com. You select the employer link at the top. You put register now. Again, it wants your group number, your name, normally within 3 to 5 days max. You actually get a username and a password. So you would have billing access. You would have access to add, change, and delete. You can add other people within your organization that maybe you want to just look, but not like administer. Adds, changes, or deletes. So you can set up view only. You can actually set up access for your broker and any of their staff. Of course, COVID just doesn't ever seem to go away. Again, we cover over-the-counter COVID testing. It's very, very easy to order those tests, again, through the Sydney app. If somebody goes into a pharmacy and purchases COVID tests, they can submit a paper claim for reimbursement. You can also go to the government website. I know I just ordered a couple more COVID tests. I had ordered through them previously, and they just sent another email out like last Friday saying that they have more tests available through that government website. So you get those also at no cost, and they are delivered through the Postal Service. So 1094, 1095 information. Again, for SACA plans, these are all put in the employer portal. The employer needs to review them. and then distribute to the employees or upload onto the IRS website electronically, or it can actually be put in the mail. The timing of the 1094s and 1095s, it's typically the end of February, Marchish, but that timeline is determined by the IRS. And then, of course, for any of our fully insured groups, so our ACA groups or our grandmothered groups, Anthem actually prepares and mails those forms out. So chamber proof, again, employers that are taking advantage of any of our discounted programs. So it could be small group, could be 51 to 99 key accounts, it could be large group 100 plus. One of the things that Anthem underwriting requires annually in order to keep the discount on your rates is proof of chamber membership in good standing. So we do this like clockwork. So it's very important when you get your renewal dues from the Worcester Chamber that you pay them promptly, because we will be reaching out through Cindy back to the chambers for confirmation that all of the companies that are taking advantage of the discounts are still members of those chambers in good standing. So for our grandmothered and ACA groups and 51 to 99 and 100 plus, we call those chamber saver discounts. And then, of course, for the SACA MIWA benefit plan, those are specifically called SACA chamber discounts, but it basically is still confirmation coming back from the chamber. Excuse me, we cannot take a picture of the chamber's website with the employer's name on it. Not every chamber, especially through COVID, had people in the office making sure that website was 100% up to date. So we actually need a current paid dues invoice, or we actually need a letter or email from somebody at the chamber confirming that that employer is a member in good standing. And then the other good news story, so for on our SACA benefit plans, we include COBRA administration as well as state continuation. So that's all packaged in at no additional cost. My COBRA plan is the continuation administrator. So once somebody is terminated in Anthem system, whether the employer or broker does it through the employer portal or whether paper is sent into Anthem membership, once that person is terminated in our system, that kind of starts the process. So we send files over the weekend to something called MIWA.io. So that is the communication tool that SACA benefit plan uses back to the enrolled employers or brokers. So of course, on state continuation, someone that voluntarily quits is not eligible for state continuation. So that's really the primary reason that MIWA.io needs to know why somebody was terminated. Was it voluntary, involuntary? For groups that are over 20 where COBRA applies, again, they're trying to, again, get more information as somebody over 65, not 65, because there's different continuations. Once that is answered in MIWA.io, MIWA.io automatically feeds that terminated person's information to my COBRA plan. My COBRA plan sends the continuation offering letter to that employee confirming what the COBRA or state continuation rates would be, what benefits they're eligible to enroll in. The employee would make the election back through my COBRA plan. They will send all premium back to my COBRA plan. My COBRA plan sends the premium back to the employer and then notifies Anthem when employees should be reinstated or terminated based on those premium payments. Excuse me, the ARC process. So This is something else that a self-funded plan needs to do. It's something that's called the 5500 form, and it's filed with the IRS annually. It's another thing, in addition to PCORI fees, that the SACA benefit plan does and files on behalf of its employers. So we kind of use the ARC process annually to collect that data. So the 5500 form can be submitted to the IRS on behalf of the employer. So when you get the communication that it's time to complete the ARC process, it's typically done in February-ish of each year. And then the collection process is normally over by the end of March. The 5500 will still be submitted, even if it's not responded to. It will use the last data that is on file. So very important to have current information. And then as far as renewals and timings, so ACA and grandmothered groups and large groups certainly have 12-month renewals. Large group can sometimes offer things longer than 12 months. SACA benefit plan has very specific renewal dates, and it's based on when the group is written. So beginning with January 1, 2021, effective dates and later, if the group was written January, February, March, or April, they renew in January 1 of each succeeding year. If they were written May, June, July, or August, they would renew May of each succeeding year. If they're written September, October, November, or December, they renew in September of each succeeding year. The whole health savings credit, if it's not applied when the group was new, it can be added at renewal or off cycle if the group adds dental, vision, or life. And then, of course, we launched SACA MIWA back in May of 2016. Any groups that were written prior to January of 2021 renew in May of each year. And then, of course, we know that not every group is going to be a fit for medical underwriting. Things change. They can change daily. They can change annually. We've got ACA groups, certainly, that have had changes in employee status that are able to go through underwriting and move from ACA to SACA MIWA. Occasionally, we have groups that are on SACA MIWA where ACA is now a better fit. So ACA plans are guarantee issue. There's no medical underwriting attached. We've got a lot of PPO plans, a lot of HSA plans. We still use our full Blue Access network across our ACA product line, as well as full Blue Card for out of state. We use a different pharmacy network, which is the select 4-tiered pharmacy formulary for our ACA plans. We can apply a 1.4% chamber discount on ACA plans. So that would reduce the filed rates with the Department of Insurance. And of course, we've got specialty discounts that we can apply. So one of the things that we added this year for ACA groups is something that's called well-being perks. So we kind of looked at what we were able to do for SACA benefit plan and said, you know, we know members are more engaged when they know more about their plan, and they can earn incentives for being engaged in their plan. And of course, ACA groups are the least healthy of the group. So why would we not give some of those groups and members similar incentives? So on our well-being perks plans, again, members can earn incentives through a gift card by taking a health assessment and tobacco certification. If they get their adult wellness exam and their flu shot, they can earn $200. They can earn $50 through a dental exam. And we've got dental automatically built into the well-being perks plans. The other thing that's really cool about these plans is the employer can earn premium credits after they renew the following year based on the percentage of participation that their employees did on the member incentives. So with something as low as 25% member participation, the group can earn a 2.5% premium credit for the following year. If they get up to 75% member participation, they can earn up to 10% premium credit, which on an ACA platform is huge. So again, it really gives the employees the benefits that they want: medical, dental, vision. It allows employees, spouses, and domestic partners, again, to each earn those incentives. And just like SACA, they would earn them potentially in different ways. And it thirdly rewards the employer by member engagement in those programs. So this is what the dental and vision plans look like on these well-being perks plans for ACA. There's an adult benefit, very standard benefit, $50 deductible, 100% for diagnostic and preventative, 80/20 on basic, so that's the fillings and cavities, 50% on major, $1,000 benefit. Very, very standard dental benefit. Again, there's a pediatric dental component that is automatically in ACA plans. And then, of course, we've got our vision benefit. So it really applies to adults because pediatric vision is also automatically built in. $0 copays for pediatric, $20 copays for the eye exam and lens copay for adult, $130 allowance on frames. So again, very, very standard vision plan. And of course, if you're looking at these options, they would show, it's kind of in this end, and I think our faces may be in the way, but it would actually say like Anthem Gold, Blue Access PPO 2250/20%/7500 WP. So you would know if it includes, so this last column is what includes the well-being perks. So that was a lot. I got 6 minutes to spare. There's got to be questions.
If you have any questions, you can share them in the chat box and we'll be happy to ask those to Nancy. And as we're waiting for that, the really exciting thing about this program, not only, could it save you and your company money and offer a great opportunity for your employees, but you would be partnering with one of our local chamber member brokers through our local agencies here in our community. So when this is over, we'll definitely send an email to all of you that are registered with that contact information. So if you would like to get started in the program, we can connect you to one of our local brokers.
Yep, but it's very easy. So again, the broker can run a standard quote. So you would know based on a census, like what the very best rate would be. Of course, it's subject to medical underwriting if we're looking at SACA benefit plan. So there's medical questionnaires that the broker would help walk you through that process. Once the medical questionnaires are completed, the broker submits that directly to underwriting. So they deal with our underwriters every day. The underwriter actually generates the final quote based on the benefit plan or plans the broker is requested and the results of the medical underwriting. So once the information comes to us, normally within 2 days, that final quote is back out to the broker. So the process is very, very quick and very efficient.
Nancy, one question. Do you offer one-on-one consultation for companies that may be interested?
I can certainly, but I don't have access. I mean, I would want to do that in conjunction with a broker because I don't have access to Easy Apps and FormFire, or the two vehicles, most popular vehicles that the medical questionnaires are completed in, secured, very high regards for PHI. The carriers don't actually have access to either of those systems. We get pushed to us what the broker submits. So absolutely. But I would definitely want to do that consultation in conjunction with one of the brokers.
Perfect. Are there any other questions? For the 2-person minimum, is that a 2 employees or 2 enrolled?
Well, we have to have at least 2 enrolled. So it would be at least 2 employees. So let's say there's a group that has 3 employees and one person is on Medicare. I've got to have at least 2 enrolling if they're not a sole proprietor. So that SACA benefit plans minimum is 2 enrolled. So if we have a group of 20, and I just wrote a group, there were 20 total employees. It is a dental lab, I guess I want to call it. The 2 dentists, I think they build like the crowns or whatever, very high female content. 2 people needed coverage, 18 were valid waivers covered under a spouse. And we wrote that group. So it was a 2-person medical group. We can't write dental on a dental office, but they did add vision or life. So there were, 20 on life and I don't know, maybe 15 or 16 on vision. So a lot of flexibility.
Any last minute questions?
And if you have any, you think about it an hour from now, you can certainly, get a hold of Samira and the Worcester Chamber, and she can get us connected.
Most definitely. Nancy, thank you so much for your time. That was a lot of helpful information for our employers to think about.
You're very welcome.
Really appreciate it.
Thanks for setting this up. I think it's, again, very beneficial. Again, that's what employees want. We're trying to make every effort to, again, have underwriting work with us on participation, and those guidelines have gotten much, much, much more flexible over the last couple of years. Another thing, we only need 1, of course, we can only write Ohio-based companies. We only need 1 employee in Ohio enrolling. So prior to probably 2020, we needed at least 2 people in Ohio enrolling. So one of the things that we found even before COVID raised its ugly head is small employers learned a long time ago that they needed to be very flexible, and the best talent wasn't necessarily in their backyard. So we've got, I have a group, 5 employees. The owner is here in Cleveland. He's got a person in Hawaii. I would like to be that person in Hawaii, a person maybe in like Idaho. He's got somebody in Missouri and somebody in Maryland. And he kind of uses that time difference to expand and kind of promote early access to his business. So he's got his person in Maryland, like she works, I don't know, maybe 7 to 3 or 7 to 4. And then kind of the Midwest takes your normal 8 to 5. And then they've got those on the West Coast in Hawaii. He's got office hours until 8 or 9 p.m. And again, he thinks that's done a lot to help him compete with some of the other businesses across the country that are his competitors.
Sure.
So we know small employers need to get very creative. So again, we've made adjustments to help them do that.
Perfect. Well, thanks again for your time, and thank you
You're
to all
welcome.
of you who joined us. And we'll be in touch soon with some additional details for you.
Thanks, everybody. Have a great day.